delay in implementing an expansion to children's mental health services. In 2011, the governor initiated a Medicaid redesign plan. That plan was to move children into Medicaid managed care. We did not oppose the plan. We put our nose to the grindstone and we decided that we would work to make sure that it would include an expansion of services for children with mental health needs. We needed that expansion because it was well documented, it was well known, it was well stated by the Medicaid redesign team that there was an insufficient capacity and an outdated array of children's mental health services in the state. 6 years we've worked to put together a proposal that will solve that problem. It's a modest proposal. It's a modest expansion of necessary services. And yet this budget makes no room under the global cap to fund our services. The global cap will rise to $20.8 billion this year. Our request is for $15 million, and yet there's no room at the end for kids with mental health. No room under the cap for kids with mental health needs. We think it's inappropriate, and we're here to tell you a little bit more about it. And next is Paige Pierce from Families Together.
Thanks, Andrea. As some of you know, Families Together is a family-run, family-governed organization that represents families of children with behavioral health needs. Our kids are in multiple systems, and we've spent the last 20 years plus working on a family peer support infrastructure that will help to prevent kids from going into more expensive, intensive placements. During that time, we've been told that the system understands the importance of our service, children's family peer support and youth peer support. And over the past 6 years, as Andrea mentioned, we've worked with the Medicaid redesign team to develop a system that would include family peer support and youth peer support so that we could prevent unnecessary hospitalizations and ER visits and residential placements. And now, for several years, the can has been kicked down the road as it relates to implementation for children's behavioral health as in Medicaid managed care. And now, we're being kicked down the road for another 2 years. The real problem with that is twofold. One is families and children. First, families and children are being impacted negatively by this. And second is that the system that was designed to serve our families and children, including family peer support, is being very seriously harmed. They were not only told that they were going to be starting on July 1 of 2018, but they've spent a lot of time and energy and money getting ready for that. And now the infrastructure isn't going to work for it because we don't have the Medicaid managed care starting on July 1. So we have a couple of speakers that can speak directly to that as they're directly impacted by it. First we want to have Shannon. Do you want to come up and speak first?
Yeah, sure. Just say your name and where. Hi everyone, my name is Shannon Zielinski. I am a family peer advocate at the Villa of Hope in Rochester, New York, and I provide advocacy for currently the waiver families that have waiver services. Back in 2008, about 10 years ago, when my family received supports and services, I was able to be connected with a family peer advocate. Shortly thereafter, it changed my career path, and I began becoming a family peer advocate myself. Became through the Villa of Hope and Families Together in New York State and Monroe County Office of Mental Health. I was able to receive my credential 3 years ago to be a family peer advocate, and now with all of the changes, let me back up. So when I started as a family peer advocate, right now I can currently serve 27 families just in our waiver program. At the Villa alone, we serve 300 to 500 other youth and families that, with the spa services in July, we were planning on being able to service all of those families in Medicaid managed care. Now that is going to be delayed, and it's going to be 2 years, and we can't wait. As a family peer advocate, it is imperative for other families to have advocates with lived experience that can share their personal journeys, connect them to resources, and guide them on their path. And so we are here saying that we really, really, really need to be able to serve all the families, not just those at the waiver level of care.
Now I'd like to offer the opportunity for the President of the Board of Directors of the Coalition for Children's Behavioral Health, Jim McGurk, to say a few words.
Thank you, Andrea. Thank you, Paige. We are so fortunate in the state of New York to have these two compassionate, strong women leading the charge on behalf of kids and families. Now, as the president of the coalition, I have the fortune to work with many organizations throughout the state of New York. In addition, I am the CEO of Astor Services for Children and Families. We provide a range of children's behavioral health services, from outpatient clinics, hospital prevention programs, RTFs, day treatments, throughout the Hudson Valley and the Bronx. So we are certainly very much affected by what's happening in the state and what the plans are to reform the Medicaid system. Our agencies have worked very closely with the state to transform the system of care. We did that because we thought we would be benefiting the kids and the families. One of the benefits of working with so many great staff and executives at our agencies, we're all committed to that one goal, to improve the outcomes for kids and families. And so we work tirelessly with them to transform the system. We did that despite the fact that our current programs were suffering in so many different ways. We did that with the understanding that resources would not be made available to support the current system, but in fact, they would be available to help us get ready for this transformation. What's important for everybody to know, during this time, hospitals have gotten billions of dollars. Capital outpatient programs that do health care have gotten hundreds of millions of dollars to help with their capital needs. Our agencies have benefited very little in this transformation dollars that were made available, despite the promise that we would be helped making this transformation. So when we heard that it was going to be delayed another 2 years, two things became very clear. One, most importantly, that the kids and families who have significant needs are going to again be put on the back burner. We work for a system that typically does not fund the services for kids and families that they need. And that's why we were so excited. We said finally we would have this opportunity. That 2-year delay means they have to wait 2 more years. And then on the other side, the agencies who have been holding on financially in preparation for this new transformation, with the understanding that the lives of kids and families and the outcomes that they would experience would be improved with this new system, and that the money would follow. So we've been hanging on, and many losing millions of dollars. And so this 2-year delay does 2 things. It, 1, delays the services again for kids and families, and 2, puts our agencies at significant risk. And so we're here to tell you and to tell the state that you've got to do something for the kids and families and those that provide those services. So thank you very much.
Thank you, Jim. So I just wanted to clarify that we in our press release, you can see that we are looking for the 15 million that would have been earmarked for the expansion to start on July 1. We're just looking for that to be continued, to be invested in the state budget, specifically for the SPA services, the services that would have been in the state plan amendment had it been started on July 1. We know that there are lots of realities and Medicaid caps and the federal government and all of that that's going on. We're just asking that the state back up our children and families. The system, there's lots of other ways that they can cut, and they were to cut that is to really, as our previous speakers have already said, harm children and families. But we're not asking for them to go ahead with the Medicaid managed care necessarily on July 1. We're asking the $15 million be invested in the community. So to talk about community mental health services is Michelle Zuck, who's the president of the board of directors for Families Together in New York State.
I'm also the director of Family Resource Network, and we serve families in Otsego, Shenango, and Delaware counties. I'm here to talk about our credentialed family advocates being the boots on the ground people that work with families. If your family is experiencing working with a system, whether it's mental health or juvenile justice or child protective, you're operating with a broken heart, most likely. A family advocate, a credentialed, trained family advocate is the most compassionate, cost-effective way of doing business to help people get through instead of sending them out to walk on a sheet of ice by themselves with a broken heart through these systems. We link arms with you, we walk with you, we get you through it, we show you that there's life on the other side, it can get better, and it's ridiculous to not fund this. So many families have benefited from it. So that's what I have.
So I would also like to take another moment to put a clarification here. So what is happening if the old services aren't providing as much service as they used to, and the new services aren't starting? Where are kids getting care? And we have heard, even from school systems at the highest level, the New York State School Superintendent's Council issued a report that the growing cost of addressing the behavioral health needs of students in schools is crushing them. It is their single greatest worry, because there are no community services to address the needs, and now the schools are trying to address the needs. Our children are waiting, and yet the message in this budget was they're not receiving services now, they can just wait 2 years. And we say no. No, they cannot wait 2 years. So in addition to the $15 million we want restored that would have paid for the transition to Medicaid managed care, we are also asking that the governor's proposal to provide community mental health supports in schools be expanded from only a $250,000 commitment to a $14.25 million commitment, and that all small city school districts and community schools have grants so that they can access mental health services that can wrap around the kids in school and make sure that the services are there for kids in communities with high levels of poverty, with high levels of homelessness, with high levels of dropout. And so there are just two modest requests to put money into services now. $15 million to mimic the services that would have happened if we moved on July 1st, the family support, the youth peer support, the respite so that families can know that their child's safe, and yet they can go and do some activities of daily living that they cannot do when they're constantly caring for a child with behavioral severe emotional disturbances. And then, skill building for the youth. Really working them through, as Michelle described, taking their hand and working through activities of daily living so that their everyday lives can be strengthened, so that they can overcome their diagnosis and become a functioning part of the community for them. And so that's it. It's a very modest, it's a small request. These are basic services. We don't need to build buildings to do them. We have the staff who are willing and able and ready to do them, like Shannon. And so we just urge the legislature to say no to this wrong-minded proposal and say yes to the expansion of mental health in schools. And now I'd like to offer that Bill Getman, also from the Coalition for Children's Mental Health Services, to say a few words.
Thank you, Andrew. Good afternoon. Good morning. It's pretty simple. It's about kids. It's about kids are our future. They're the ones that are going to take care of all of us when we need services. They're going to take care of the future of this state. This state has some serious concerns in terms of our future. We need to invest in children. We need to keep kids under the mental health system. Upstairs today, the mental health commissioner is testifying about the needs of mental health across the state. The legislature keeps asking, is the system ready to deal with the needs on a community basis? And our answer today is, not unless you put money into it. So we urge the legislature to look hard at the budget, identify these two pots of monies that they can restore so kids get better service, because they are our future. Thank you, Andrew.
Thank you, Bill. We have another provider who is on the board for Families Together in New York State and works in Monroe County. Chuck Allen.
Thank you. I just want to focus a little on, after about 35 years of working with vulnerable kids, and trying to shift the services and supports that are available to you into the community and home, away from institutional kind of placements. Unfortunately, there's never enough money, but we have an inordinate amount of money that we're spending on hospitals, residential placement, and those kind of things. What the Medicaid redesign was going to do, finally, was to help make supports for families available before they got to that level and to prevent that. There's no doubt in my mind, if we did this effectively, we would reduce the number of kids in foster care, we would reduce the number of kids in juvenile justice, we would reduce the number of kids in special education. Right now, we have a patchwork of services that if you're lucky, you get it. If you can negotiate, you can get it. This proposal offered a comprehensive package for families that they can get soup to nuts services. The breakdown of this is just pushing us back into a system. We've invested in a transformation that now cannot happen without this funding. And to be honest, I'm concerned that we've actually broken the system more by not making this happen.
Yeah.
One other thing I'd like to mention is, many of you've heard of the Adverse Childhood Experiences Study. We know, science has told us, we know from research that if children have adverse childhood experiences, the expense later, not just certainly the fiscal expense, but also the expense to their lives is so much greater as adults. And we have the opportunity, and the state has the opportunity to minimize that and invest now in our children and families so that we don't have the kinds of expenses that they have in the mental health system now for adults and other systems as well. Health, substance abuse, all of it is absolutely related to how a child's childhood goes.
So Paige and I are here together, our groups are here together, the providers and the families. We have over 400 people meeting with legislators today, urging them not to allow the decision that the governor made in his proposal to stand, to reverse that and then to make an investment in school-based mental health supports and really serve our kids instead of telling them, you're not getting the service now, you can wait 2 years. It's not the message we accept, and we thank you so much for being with us today to help spread that message. Photo on? Oh, questions? Any questions? Anyone? Does anyone have any questions about how we're